Welcome to Face Sickle Cell. My name is Virginia Pertiller, Executive Director for Citizens for Quality Sickle Cell, and today we're going to be discussing a very topic. It's a topic that's worthy of your sitting and viewing this tape with us today. I have with me today a guest. Her name is Dr. Victoria Odeshina. And today's discussion, we would like to embark you on a conversation, a discussion regarding emergency room protocol guidelines. Welcome to Face Sickle Cell.
Let's face it, there's a lot you don't know about sickle cell disease.
Like that it affects almost all races.
Like that it affects millions.
That it can be unbearable.
That it's the most common genetic blood disease in the country.
But awareness and understanding are still far too uncommon.
Let's face it, there's a lot you don't know about sickle cell disease.
And that's a disease too.
Call the 211 info line to learn more.
Hi.
Hi.
Well, I would like for you to introduce yourself because I think you can do it much better than I can, and because you come with you're a trailblazer, and I look at you as you're the founder of Citizens for Quality Sickle Cell, but even more than that, let's talk about your history, your life, your children, before we go into this discussion.
Thank you very much for that kind introduction, Virginia. As you rightfully said, I am first of all, a mother of 3 children, 2 of whom are living with sickle cell disease and 1 who has sickle cell trait. I am the co-founder of Citizens for Quality Sickle Cell Care, Incorporated. I am also a nurse. I just received my doctorate of nursing practice. And I am very thankful to God and to all of the people that have helped me to help others that are living with sickle cell disease and their family members. So it has been a community effort. And I hope that today we will continue in our quest to improve the care of people living with sickle cell disease in the state of Connecticut.
Thank you. Let's just assume that our viewing audience do not know or maybe just have heard of sickle cell. Can you explain what is sickle cell?
Sickle cell is, or sickle cell disease is a term used for different types of hemoglobin conditions whereby their red blood cells sickle. It's a inherited condition, which means you inherit 1 copy of the gene from each of your parents. It means you inherit 1 copy from your father and 1 copy from your mother. And as I said, it's inherited, just as we inherit the color of our eyes, the shape of our nose, the color of our hair, how short or how tall we're going to be. That is how sickle cell is inherited. It affects the red blood cells. So which means instead of the red blood cells staying round, it changes into a sickle shape. And that changes into a sickle shape is what causes it to block the blood vessels. Now, we used to think that just blocking the blood vessels is what causes the problems with sickle cell. Now we have found out that it's a complex problem. In addition to the change into the sickle shape, there's also inflammation that's going on in the blood vessels. In addition to the inflammation, there are enzymes that are secreted that allows the red blood cells to dehydrate, and also for the blood vessels, the inside of the blood vessels, to form a gooey substance that allows the red blood cells to be sticky into the to stick to the inside of the blood vessels. So it's a complex problem that's going on. So it's not as easy as we think it is. So that is why it's very difficult to treat sickle cell.
And I understand that one of the hallmarks of sickle cell is the pain.
That is correct. When there's this blockage and inflammation going on with all the enzymes that are secreted, it causes pain. And pain occurs wherever there's this blockage and there's tissue damage. And that is the sign that people get that there's a damage going on around the tissues where the blockage and inflammation is going on. And pain occurs in areas that are very close to the bone, because this occlusion or blockage occurs in any part of the body where there's blood or blood cells. And as we know, blood circulates all over the body, so it can happen in your eyes, blockage can happen in your liver, it can happen in your lungs, it can happen in your kidney, your bones. Blockages occur in your eyes, and people with sickle cell can go blind. It can happen in your lungs, and people with sickle cell can have lung damage. Your kidney, and people with sickle cell can have kidney damage. In some instances, when it happens in your bowels, in your kidneys, and in the brain, people have stroke. So instead of having pain, they would not complain of pain, but they may have stroke. Some of them as young as a few months old may have weakness that may be short, and nobody will realize it, and they have permanent damage. And if it happens in their intestines or the kidneys, they may not have pain, but the damage is already done. And this goes on all the time. It's something that occurs always, even when they're sleeping. So the only time you realize that someone is in pain is when we see them in the emergency room. Many times they manage these pain episodes at home. And that is why pain in sickle cell is very important.
Well, I'm glad to hear you say it that way, because that really gave a real intense look into sickle cell, the pain. Now, we know that there are many who are suffering with sickle cell all across the country. But when they enter into the emergency rooms, what were some of the things that were being found that they were experiencing to lead this group to come up with emergency room guidelines?
Yes, the group we are talking about is the statewide stakeholders. And the stakeholders is comprised of people from the state of Connecticut, including people living with sickle cell disease, professionals, doctors, people like yourself, community-based organizations, the people from the Department of Public Health, including the Deputy Commissioner, people who care about the quality of care for people living with sickle cell disease. These are people who have come together to say, we need to do something about sickle cell disease. You will find out that there are conditions that do not have enough, that do not have as many people that are affected with sickle cell disease that receive better care than those who have sickle cell disease. So they have taken this upon themselves to address this issue. So this is the group of stakeholders that you are talking about. Now, to address your question, what is it about it that made us decide to address this issue? The reason is that, as I mentioned earlier, the blockage of the tissues causes organ damage. When the blockage occurs in the kidneys, the eyes, the lungs, there's organ damage. And you know the blockage occurs from childhood until they live, if they're lucky to live up to 48, 50 years. The life expectancy for people with sickle cell disease now is up to, average is about 40. And what kills them is organ damage, multiple organ damages. When it happens in their heart, they experience similar problems like somebody having heart attack because it blocks the blood vessels that supplies the heart. It's the same thing that happens with people when they have sickle cell pain episode. So that is the reason why, unfortunately, that is the reason why this group decided they need to address it. And the experience, people with sickle cell disease experience inadequate care in the emergency department. And it's been documented. There are studies that have documented delay in care. Some of them stay there for hours on end, 8 to 12 hours without being treated. They have been accused of drug-seeking behaviors. They have some of them because they are minority population. They think they are there to seek drugs so they can sell it. Some of them have been accused of being drug addicts, that they have come to the emergency room to have their fix. And even when with the guidelines that have been developed in the past, if they are required to have maybe 10 milligrams of certain medications, and the doctors are even aware that they're supposed to have that medication, at times the doctors may say, well, you are not in so much pain, I'll only give you like half of it. And there have been studies that documented that even when the doctors ordered half of it, the nurse may say, oh, I'll even give you half of that, half of the dose that the doctor ordered. So for years, people with sickle cell pain that have reported to the emergency room have suffered from delayed treatment, under treatment, stigma, and discrimination. So those are the kind of problems, and these issues have caused negative relationship or poor relationship between patients and the doctors, and it has developed an issue of mistrust between the medical system and the patients. The patients do not trust the doctors do not trust the patients. So that has been a big hurdle, and that is why this group have taken up this task.
Wow, that is some awesome information to know, particularly because, you know, part of what Citizens for Quality Sickle Cell does is that we also do the circuit of going to the hospitals to visit with sickle cell patients. And, you know, we hear a lot of the different variations of how they're being treated when they come into the emergency rooms and also while they're in the hospitals. So this is really information that everyone needs to understand that is taking place, because we need the advocacy, we need the support of the larger community to step in and step up to help with the issues that sickle cell disease patients are dealing with, individuals are dealing with. At this time, we would like to take a short break, but we would like for you to stay with us as we continue this discussion. We're sure that it's going to even go up a little higher in terms of what will be shared. So please stay with us as you face sickle cell. Thank you.
Let's face it, there's a lot you don't know about sickle cell disease.
Like that it affects millions.
People in almost all races.
Black and white.
Indian and Asian.
Hispanic and Mediterranean.
And that it can affect you or someone you love.
No matter where you come from.
Let's face it, there's a lot you don't know about sickle cell disease.
And that's a disease too. Call the 211 info line to learn more.
We would like to welcome you back to Face Sickle Cell. We are in a discussion right now on emergency room guidelines protocol. And I have with me today, my guest today is Dr. Victoria Odeshina. And we were just discussing that this year marks 100 years that sickle cell was discovered here in the United States. We know that it existed long before that, but in the United States, this is the marking of 100 years. And so the emergency protocol guidelines is very apropos because we know that there's been time that has elapsed where this could have been happening, should have been happening, but it hasn't. So let's get into the discussion. Exactly what are these emergency room protocol guidelines?
Thank you for asking. What we have done is that a group of professionals, consumers, and emergency room doctors, pain experts came together and worked over several months to look at the evidence that's out there about what works best for people with sickle cell pain. And we have come up with a guideline or what we would call a clinical pathway of what to do when someone comes in with sickle cell pain. Let me remind our audience that as you mentioned earlier on, there have been several guidelines. For example, there was one put together in 1992 or 94 by the American Pain Society, of which I was a part of, that gave an idea of what should be done for people when they're in sickle cell pain. And that guideline recommended that when someone comes to your emergency room, because of how severe the pain is and the potential damage it could do to that person should receive their pain medication within 15 to 20 minutes of arrival to the emergency department. With the pathway that we developed, we put into consideration the competing needs that may be happening in the emergency room at that time. So we try to make sure that the person will receive their first pain medication within half hour of arriving to the emergency room. And this, I said within 30 minutes of arrival. That does not mean 30 minutes of registration. So which means emergency departments will need to make an effort to identify sickle cell patients when they come to the emergency room. And the idea is to make sure that we conserve the patient's energy, we conserve their structural integrity, their personal integrity, and also their social integrity. If we put all these in mind, which is integral to any medical care that we provide to patients, we will be able to provide adequate care. We have done this at the Uconn Health Center, and we know it can work. Where there's a will, there's a way. The idea is to make sure that we put things in place, we train the staff, and that the patient, if the patient has to be admitted, the patient gets patient-controlled analgesia, which is a pump that the patient can control by themselves. That way, when the staff is busy doing something else, the patient will not be left alone. What we're finding out is that patients are left 5-6 hours without being given the next dose of medication. And unfortunately, their pain gets worse. The other thing we put into this guideline is that once you medicate a patient, the patient requires re-evaluation every 15 minutes. That way, if the first dose of medication doesn't work, you can work with the patient to find out what else you need to do for that patient. It's always a collaboration between the patient and the provider. That way the patient will know that you really care so much about them instead of leaving them without any treatment. And not just giving them pain medication. We're finding out that patients used to be given narcotics like morphine, Dilaudid, without being given the other kinds of medications that are required. For instance, ibuprofen or ketorolac. So the other aspect that we added is that when you give ketorolac with morphine, it reduces the amount of morphine that the patient needs, and it also reduces the length of time that the patient stays in the emergency room. These are the kind of evidence-based practice that is provided right now to patients, and we're trying to bring to our people with sickle cell disease. So in a nutshell, this is what the practice is about, and we're trying to make sure that our emergency departments try to incorporate this into their practice.
Okay, and so let me ask on the other side, what are the recommendations for those who are living with sickle cell disease? How can they come prepared? What's happening for them to be educated about what the protocols and the guidelines will be?
One of the tasks of this group also is to try to educate the consumers in the community. We will work through the community-based organizations, the providers in the community, to set up a workshop to introduce this guideline to them so they know what to expect when they go to the emergency department. And also to work with their primary care provider. I must say that this guideline is for those who do not have an individual care plan. The ideal plan is for each person with sickle cell to meet with their hematologist or primary care provider and develop a care plan of how they want to be treated in the emergency room. If this care plan is in place, the hematologist or the primary care provider will work with the emergency room staff, and they will put this record in the emergency department with a copy for the individual with sickle cell. And this will be an understanding, and there will be a seamless communication among all the providers. Now, with this in place, and this should be updated all the time, with this in place, there should be no problem getting adequate care when a need arises to receive care in the emergency department. This clinical pathway that we developed is for those who do not have an individualized care plan that they have developed with their provider. So that if you go somewhere in emergency and you do not have something in place already, this is for you to receive adequate care. So we're urging everybody with sickle cell disease to meet with their hematologist or primary care provider and set up their own plan of treatment so that it will be in the emergency department for when they want or when the time comes for them to receive a pain management in the emergency department. So to answer your question again, we will try to educate everybody and let them know what to expect when they get to the emergency room. And I think we will go through the community-based organizations, the emergency room directors, the hematologists, and there will be announcements and posters that we will send out to let people in the community know that this is going to happen.
Thank you for that information. And serving as the Executive Director for Citizens for Quality Sickle Cell, I would also like to say that if you do not have a primary care provider, we are in partnership with community health centers, so that if you don't have insurance, that should not be an issue. You should contact our organization, area code 860-223-7222. And if you need other information throughout the state, you can also dial 211 and ask for sickle cell, and you'll get the other community-based organization in the state of Connecticut as well. But this is a wonderful conversation, because I think that it needs to happen. People need to hear that there is movement. I hear so many people say, well, what's going on with sickle cell? You don't hear about it. You don't, there's no information. There's no advertisements on TV like there are for other diseases and illnesses. What is going on? So this is going to be a landmark kind of situation. Although it's happened before, we know that sometimes we have to keep doing things over and over again until it catches. And so we're praying that it's going to catch, so that those who are suffering in silence, which are many, who will not even go to the emergency room because of the way they've been treated previously, they hesitate. So that pain management that some are trying to instill in their lives so that they don't have to interface with the emergency rooms, that's what many are living with right now.
That's correct.
So this is a worthy cause, and we hope that when the time comes out that we are sharing the dates and locations for education, that individuals, their families, friends, and those that are supporters of sickle cell, you come out, please, so that you can be educated about what the protocols are in the emergency rooms throughout the state of Connecticut. Are there any parting words that you would like to share with us about the protocol? Because it's so much that we can discuss, but we know we can't do it all today, and I'm hoping you'll come back and share more with us. But is there anything that you would recommend?
Well, I would like people to learn as much as they can about the condition, and like you said, there are so many activities going on in the state regarding sickle cell disease, and people are invited to participate. If you don't participate, you won't know what is going on, so you are welcome. Find out about it and be part of it, and that is how we can move on and make a difference.
Okay. Well, if you would like to contact our organization, again, it's called Citizens for Quality Sickle Cell Care, Incorporated. I'm sitting with the founder of this organization, and our address is 100 Arch Street. We're located in New Britain, Connecticut. Our phone number is area code 860-223-7222, and our website is www.cqscc.org. Again, you have just participated in Face Sickle Cell. We thank you for viewing this program today, and we hope that you will contact us and join us again in the future. Thank you very much for joining us.